Bonjour, mes amis. Welcome this evening. I have the delight and pleasure with a co-panelist, a co-expert, walking through cancer. I was going to say the wonder and glory of cancer, but that is not accurate. But I mean, we are talking around the wonder and glory of the power that you may have over cancer, and so I don't think it's all doom and gloom. Um, so before I descend into a word pool that doesn't make sense to anyone, I want to introduce our co-host. I have Dr. Tracy uh, Steady Hardcastle, who is one of our in-house clinicians who supports a lot of our patients here at the DNA Company. And I'm very excited and elated to welcome her to this conversation because she is a doctor of Chinese medicine. And so she comes with a really valuable and also very unique perspective on cancer and what we're going to be talking about tonight, namely, how can you go about preventing it? So, Dr. Steady, welcome back.
Thank you. It's nice to be here with you. It's always
Yeah.
fun.
Yes, ma'am. Yes, ma'am. And I'm excited for tonight's conversation because I think it's a very loaded and tricky conversation to have, right? Even from the introduction, I was struggling with how do I talk about this with pep because there's so much pep to be had in this space, but with the acknowledgement of it's a very difficult thing that often when it touches, be it our own lives or someone's life who we love, it's not an easy, a pleasant or a welcome thing. Yeah. Yeah. So I wonder, um, I want to introduce the topic. I want to introduce why we care about cancer, in particular, the rising rates that we're having. And as I do that, please do fill out our survey questions. If you're not yet a frequent offender on some of these webinars, what you do know is that, or what we want you to know, is that we really care about why you're here. We want to ensure that we're serving why you've shown up today, and that survey helps us to do that. So we're going to introduce cancer and then we're going to jump to that survey to understand why you're here. So Dr. Steady, as a clinician, something that's been concerning me over the past decade or two has been the rise in the rates of cancer, in particular, cancer that's being diagnosed in as what clinicians would call early onset. And for the folks at home, what we call early onset really is anything before the age of 50, right? So at 50 plus, if you get cancer, it's kind of, we expect it to a certain extent, but we don't expect it in younger populations. Um, a Journal of Oncology, British Medical Journal, I think it is, studied over the course of several decades, so from approximately the 80s until the early 2000s, the rate of cancer diagnosis in people under the age of 50 increased by almost 80%, which is just an incredible rate. To kind of ground that, right? To ground that rate a little bit, when we talk about, unfortunately, the deaths that came from those cancers, right? We're talking about very different things, right? A lot of people can get cancer and kind of move past that, right? But for those that actually, unfortunately, succumb, the rates increased by about 30% in the same period, right? So we're not talking small cancers that we're able to address with current mainstay medicine. These are cancers that truly impact lives, that leave little children without parents. Dr. Steady, are you in your practice? I know you've been practicing for a while. Are you seeing this increase of rates in your practice?
I absolutely am, and it actually, in my family, my sister-in-law, when she was 31 and had an 8-month-old baby, was diagnosed with breast cancer last about a
Mm,
year ago.
yeah,
And she is currently cancer-free. She's doing great. She is technically cured, but
mm,
the feeling of having that happen, it was sort of a little bit unbelievable to the whole family, and also very scary. Um,
yeah, 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 yeah. I think as much as we progress in regards to cancer treatment, right? As much as we can say we've progressed even in the past 5 years, leaps and bounds and yards compared to where we were, that doesn't change the embedded terror, I think, that the big C word comes with, right?
mhm.
Yeah.
Yeah, and I think one of the things that in particular about cancer, unlike other things, is because of the fear.
Yeah.
Um, there's a desire to um, uh, say, oh, that couldn't happen to me.
Mm.
And to try and go into denial or say, oh, well, that's, I told them they should have stopped smoking, or, you know what I mean? Kind of separate ourselves from
Yeah.
someone who has the diagnosis
Yeah.
because it is so scary. And I think that, one of the exciting things about being alive now is that we have access to better testing, better treatments, and things like that. So that I think that if we could make better peace with it by optimizing ourselves. One of the things that I think about is I'm going to go into a rose bush analogy. I'm sorry, it's
Yeah.
happening. I have this rose bush that came with my house,
Mm.
and I think it was last year. It had like 5 things go wrong. It had spongy moths and beetles and 3 kinds of powdery mildew or something like that. And it had no leaves and it was just horrible. But I had been taking very good care of it. The people who lived here before had taken good care of it. And in the fall, it got 12 leaves and it actually blossomed. It's going to be fine this year. And
Yeah.
so when we start with a healthy body and we think, okay, I can make it through
Mm.
the treatment, which is often very difficult. That's the thing about cancer, is
Yeah.
that the treatment for it can be so challenging that there's fear even about that. You know what I mean? It's not like,
Yeah.
having something removed from your skin doesn't feel that scary, but chemo and radiation feel really scary. And
Yeah.
so the more that we can optimize ourselves through our genetics, through our lifestyle, through all of those things, the better chance we have of successfully completing the treatment and surviving. So
Yeah.
I know that was a little bit of a monologue, but uh,
No, I love it. And I think I would also offer research underscores that, right? So during my internship and during my training for naturopathic medicine, something I did was I participated in the oncology shift. So I saw a lot of cancer patients. And so what was really important for me to understand was the support that I was offering, was that to a positive end? Was it to a helpful end? Right. And one of the more interesting studies that came out, and so this came out about 10 years ago, it looked at, and it was a small scale meta-analysis. Meta-analysis means you're looking at several studies. You're not just looking at one, several studies. A meta-analysis found that when you incorporate adjunctive care into the cancer plan, so we're not talking about replacing, we're not saying no chemo, no radiation, just this other stuff. We're talking about doing both. Treatment outcomes were better. And they hypothesize the reason behind that is because you're going in with a stronger body, as well as during that navigation of chemo and radiation, you're better supporting the body so the body can effectively survive those treatments. Because we now, like, we know that those sorts of treatments kind of blow up the body, right? They are not helpful to the body. There's a reason we don't want to give you chemo and radiation unless you absolutely need it, because it is very harmful and toxic to the body. But if you go through to the end of you come in with a strong body and then separate to that, you maintain that body, right? Your treatment outcomes, your success outcomes are going to be better, as well as your longitudinal outcomes. Because unfortunately, once you've had cancer, the risk of heart attack and all that other fun stuff after the fact is quite increased, right? So so I wondered today if what we can start having a conversation, because what we promised people a little bit this conversation would be, let's understand how we can understand our genes to the end of creating a really tangible, helpful treatment plan, right? Prevention plan, really, in this instance. Okay. So I wonder if we can start, for the audience's sake, Dr. Steady, and maybe you can start on this. Can we talk about the difference between inherited cancer genes and then separate to that, acquired cancer genes? Yeah.
absolutely. So when I think about inherited, those are things that we're born with and they're not going to change over the course of our lifetime.
Hmm.
Eh, So, and a lot of people get tested for things like BRCA for that very reason,
Hmm.
because it's a familial thing. People can be tested for it, and they can know from the time that they're born, if they wanted to, whether or not they're
Yeah.
carrying that.
Yeah.
Whereas acquired means that, as we go through life, things happen. We're exposed to different things, and they can cause what are called mutations in our DNA.
Hmm.
And so those things are acquired because they happen over time and that we were not born with them. it's a sort of like an insult to the system that causes something to go wrong. Is that an okay explanation? Yeah.
That's a beautiful explanation. So I want to jump back a little bit. I think we're going to focus more on the acquired ones, but I want to jump quickly back to the inherited. So you mentioned BRCA there, right? And so a lot of people
Hmm.
have familiarity with this, and this is one of the premier genes when it comes to observing either breast or ovarian cancer. And so if you are a female and you have a history of that with other females in your family, oftentimes doctors will say, well, let's get this tested because based on certain mutations, you're going to have an increased risk for cancer. Now, a few things for people in the audience to understand. Number one, that does not mean you will get cancer. That does not mean it. The World Health Organization and other health related bodies have studied this. And when we talk about cancer, and short of pediatric cancer, pediatric kind of being child, that's kind of goes into a different category. But
Hmm.
once you pass the age of 20, okay, once you're past 20, when we look at the risk of cancer, only about 20% sits in your genes. The other 80% is diet and lifestyle. Meaning, and again, there's going to be some fancy math here, but meaning, let's, heaven forbid you have that BRCA mutation, you have that increased risk. That by itself does not give you breast cancer. It can increase it, but there's that 80% wiggle room of what can we do to prevent, right? To mitigate that actual risk, right? I see a nodding. Yeah. Yeah. So I think when you talked about people sometimes putting their head in the sand, this is one way people might put their head in the sand. There's a family history, and then the decision, I don't want to know those genes, right? Yeah. Yeah. And by and large, they're helpful to know. Yeah. Guides treatment. Okay. So let's talk through some of the acquired genes. And I think you and I, before all this, were talking through two different examples of genes that they themselves are not cancerous, meaning if you have a mutation, it doesn't, it's not like a BRCA that you inherit and that increases by birth from birth, your likelihood of cancer. But instead, you're born, and then over the course of your life, there's going to be different diet, lifestyle, exposure things that will modify how your body engages with that part of the genome, and therefore can increase your risk towards cancer. Right. So Dr. Steady, do you want to start us off by talking about um, a protein, um, P53, that is associated? So for everyone in the audience, when we talk about genes effectively, they're just kind of like cooking instructions for different proteins. Okay. So Dr. Steady right now is going to talk about a protein. Remember that this is coupled back to a gene. So Dr. Steady, the protein that is P53, what does it do and why do we care about it since we're talking about cancer?
Um, it One of the it acts as a tumor suppressor by it's involved with um, apoptosis, which is cell death,
Yeah.
and um, it's that's something that the body does on its own. So there are several different ways that our bodies. I'm gonna step back for a second. There are
Mhm.
different ways that our bodies naturally have to deal with cancer because there are mutations
Yes.
happening all the time, and our bodies are dealing with them. So we've got tumor suppressor genes, which to help prevent excessive cell growth and division, um, DNA repair mechanisms, which the body has built in. It's sort of like your mechanic for your DNA. Um, our immune system helps to do
Mhm.
that. Both our general immune system and also our adaptive immune system. So you've got all of these mechanisms that are happening all the time, and something has to go wrong with all of them in order to um, and that's what can happen. Now I got off track. Okay, so
No,
the
you're totally on
P53
track.
protein, it is part of that. So
Yeah.
okay, I'm going to stop there because
No,
I went off on a
I
tangent and I couldn't bring it back around. It happens sometimes.
I love it. No, but I think you were going somewhere really smart. So what you established for us was when it comes to cancer, really what we're talking about is uncontrollable cell growth, right? And cancer bubbles, this isn't friendly to hear. Cancer bubbles up in your body every single day. But through the glory of your body and all these things that Dr. Steady just listed here for us, your body has many different ways to quash that down, right? So as you were talking, one of the examples I thought of is like when I when I talk about science and medicine, I get really excited. And sometimes I lose track of myself and I just go a mile a minute and I'm not able to properly communicate. Right. And this is very much what's happening in the body, right? Your body has certain things it has to do, and it should go at a certain pace so they're functional and people can hear them and understand. But if I get really, really excited and I talk really, really fast and then no one can understand what I'm saying, right? What this P53 does for us is effectively one of the ways that it's like, yo, calm down, speak more slowly so you're useful, right? And then you're saying as well, when it comes to uncontrolled cell growth, there's going to be other things that are going to be telling me to calm down, right? It's not just, for example, you being like, yo, Krista, you gotta shh.
Yeah, we'd have a bigger panel of us to do
Yeah.
that.
And but I think what you're getting at is really, really important because I think P53 is a very important mechanism to calming down, to slowing, right? Especially when cells get out of control, right? It tells some cells, just cut it off, stop it, right? But it's not the only mechanism. And so it's not the only thing that is going to be stopping cancer growth. But coming back to this idea of kind of acquired gene mutation or acquired, I guess, uh, poor acquired gene expression, that's the better phrasing there, right? When you subject TP53, that's the gene that codes for this protein that tells me to calm down, okay? When you subject that to many different things, radiation, it's definitely one of the more studied ones. I think there's viruses, right? When you expose it to certain viruses, when you expose it to different damage. So think of, again, toxins, UV. There's a few other things that can damage your genome, right? Once you damage this gene and damage how it's being controlled, it's not created enough. And therefore, the message of calm down is not being given enough, right? So that's one way our life can acquire that sort of thing, right? Some very obvious things of like, people tell you don't smoke, that'll add to it. People tell you don't go out in the sun, get a sunburn, that's going to add to it. But some less obvious things like viruses, right? I think it took a long beat for science to acknowledge, right? For medicine to acknowledge that viral illness caused cancer, right?
Absolutely,
Yeah.
absolutely. Now, Chinese medicine has factored that in for a really long time as one of the
Hmm.
external pathogens, as one of the causes of any kind of imbalance. So we always,
Interesting.
we kind of go through a list of, well, how did we get here? What
Yeah.
originally happened? And that is one of the things that that we do take into consideration is like that being unresolved in the body, like a latent pathogen, or that it's just that it triggered something.
Yeah.
Um,
Yeah. Yeah. I think for the audience, I think one of the more wonderful things that Dr. Study is going to add to this conversation, at least in my opinion, is that Chinese medicine has had a conception of many different illness patterns, including cancer, but not necessarily the fancy, wrapped in fancy science words. So to me, it's always amazing. I'll talk to Dr. Steady and I'll be like, hey, I found this thing in genetics. And she'll be like, yeah, the Chinese knew about that millions of years ago. Maybe not millions, but she gets saucy with me. And then I say, okay, all right, I'll sit down. All right. So let's jump into the next. Let's jump into the next gene that we can acquire some issues with, right? So the first gene there, the first protein we talked about, not making enough was the issue, right? And now the next one that I want to talk about where it's making too much is the issue. And I think this rings home for a lot of people, especially that statistic where we talked about younger folk are getting cancer. Um, and I'm curious if there's anyone in the audience that is also experiencing this. So when it comes to colorectal cancer, we know the rates over every age group have gone up astronomically within principally the Western world. We're seeing that trickle down into other worlds, by the decade, but principally within the Western world, the rate of colorectal cancer, which was almost absent, maybe 100 years ago, are up there, right? And largely, this is attributed to diet and lifestyle, right? We're not pooping enough, we're not eating great stuff. It's kind of you're just effectively holding on to toxins, and therefore you're getting that exposure. But from an acquired perspective, right, scientists are really diving into this. We don't want our young folk dying. They're diving into this. And one of the genes that has been found and associated to this is HMGA1, alphabet soup. Dr. Steady, let's talk about the alphabet soup. What is this protein and how does it associate to colorectal cancer?
Well, it is something that responds to stressors, including infections and inflammation triggered by a poor diet. And when it gets overactivated, then it it's it wants things to grow and not to stop growing. So it encourages um, the tumors to grow and to invade from one type of
Mhm.
tissue into another. So it's sort of like when your neighbor puts their compost pile in over the line in your yard. That's kind of what it likes to do. So I like gardening analogies because I'm thinking spring. So my apologies if we keep going back to gardening analogies. It's
You
just
just you burst my heart. You are so, take this as a compliment. You're so wonderfully crunchy. For the audience, I'm calling her granola. When you were talking, I love that that was your analogy because mine was a lot more crass. All I thought of was, one person can start to bully, right? And then the crowd kind of comes in and encourages that person to bully,
yeah.
right? And that's the idea here that when you acquire a mutation there over the time, like because you've assaulted your genes, and let's talk about that very specifically because I think this is a very elegant example of how toxic bowel can quite literally change your gene expression. But what happens is when you acquire this change in expression, you create more of this protein, you create more of that crowd that encourages the bully to create the cancer, the bully to beat up on your colon. I kind of like your compost analogy more though.
But yours is very apt.
Yeah.
So
It's mean. I don't like being mean. All right. But let's again, because I think this is really where we can start that transition between what can you do about this, right? So we've just talked about in your colon, because it's doing a lot of digestion, the cell turnover there naturally has to be really high, right? Cells within your colon will turn over every 1 to 3 days depending on the cell. So to an extent, my colon right now today, next week is going to be very, very different from a cellular perspective, right? So these cells naturally turn over at quite a high rate, okay? Which, because of that, because they're always replicating and making themselves, they become really prime towards DNA damage. Because think about it, if you're always, replicating yourself, there's more statistically speaking, because the more you do it, the more you're going to have errors. So having a few proteins within there that don't allow that replication, that keep everything in check, is really important. And what we're saying from a diet and lifestyle perspective, right? You're taking in a really bad diet, right? You're not pooping enough, meaning your poop's sitting in your colon longer, right? It's sitting in there with a bunch of junk, right? And that is beating up against these cells and creating that stress and trauma that changes and acquires that protein mutation, right? That then creates the crowd that then encourages the bully that is cancer. Oui, c'est bon?
which means that even if your body is doing a great job in the rest of the detoxification pathway
Mhm.
of dealing with it, but something is supposed to actually leave the body, like the
Mhm.
actual getting out is like the final step, right? So then these things are still just in you. And so you want to get them out. So that it's about if you're not eating great food, that's not great for you anyway. But also because, some people call pooping phase 3 detoxification. And so if there's something wrong with that, that's going to have effects on the system all the way. Things are just, and they can be reabsorbed instead of
Mm-hmm.
passing out. They can go back into your system and wreak havoc. So you got to get
Yeah.
them out.
Yeah. And
Let
ladies who are,
go.
yeah, ladies who are concerned about the impact of estrogen, this part's very important for you to hear. One of the best ways your body's getting rid of some estrogens is you quite literally poop them out. But if you're not pooping, those estrogens are coming back in and creating havoc there. Yeah. Yeah. So I wonder before we transition into, because I want to dig more into that conversation of, because I think you said a very beautiful thing there. Even if you're doing one thing, even if you have other really great detox pathways, right? But you're not doing this very basic thing, right? You're kind of setting the stage, you're encouraging the stage. So I want to dig into really and truly those things that we have control over, right? That shift that genomic conversation from let's protect against cancer to let's become a crowd that further creates cancer. Before we do that, I wonder if the gods that be can toss up our poll questions because I want to know who's here tonight. Ah, merci, gods that be. So we asked the question of how old are you? Oh, Tracy, you're gonna love this. 40% of our audience is over the age of 70.
I
So
do love that.
we all love that. So welcome and thank you for being here. Um, and the next biggest crowd here is 45 to 59. And then we have some 60-year-olds and we have some people holding up the bottom with 30 to 45 as well. So welcome all. We're grateful that you're here. And I think, and I hope in particular, right, for those that are 70, identify yourself in the chat. Are you here because there's been an experience of cancer, or are you here to kind of pass the knowledge down to the folks that are younger? So we want to make sure we're serving you there. Um, we asked the question of, have you had cancer or is this someone who's close and dear to you? Um, it's across the board, right? About 40% of our audience has had someone close to them have it. About 30% have had it themselves. Um, and then 13% is saying they haven't, but they're aware of kind of a friend situation. And then there's a beautiful 18% that's saying, I haven't had that firsthand experience. And I hope for everyone that remains that way for you. Yeah. The last question that we were asking here is what cancer risks concern you the most? And this will really inform kind of where we focus on in this next conversation about what you can do. Um, so the first, or I guess there's kind of an even split between three. There's a lot of people aware that inflammation and chronic disease contributes, and they're concerned about that. They're very concerned about toxin exposure and capacity to detox that. And then also just the genetic predispositions, in particular, some of the inherited mutations. Yeah. So thank you to the audience, and we'll make sure we're honoring that as we go through. So, Dr. Steady, someone comes to you and they're saying, I don't have cancer, but I'm kind of concerned about it, right? Let's maybe first talk testing, preventative testing, right? And then let's dive into what you're going to be suggesting for diet and lifestyle. So, from a preventative testing perspective, where does your head go? In particular, remember that for younger demographics, and I appreciate this isn't necessarily going to be on the webinar tonight, but please share this with the people that you love. Younger demographics, so we're talking under 50, unless there's a history of cancer and your physician is actively screening. So, for example, unless you know that mama had breast cancer and she had it at 35, therefore you're going to get screened earlier. Unless there's that, there's really no screening for cancer until you're in and around 50, depending on the region, depending on your guidelines, right? But we know that cancer is rising here. So for the person that comes into the office and says, I don't necessarily have any direct family relations, maybe a cousin or two, Where does your head go from a testing perspective? Because they're kind of sitting there in this pool of a little bit of worry. You know, we don't want to encourage worry. We don't want to go digging for something that doesn't exist, but we also don't want to dismiss and be like, don't worry about it until something pops up, right? Where does your head
Yeah,
go?
absolutely. And um, the sooner someone knows, the sooner they can do something about it, right? And a lot also, if
Yeah.
people are worried about it and they test and they find out they're totally fine,
Mhm.
then they can relax and not think about that for at least a
Yeah.
year or something, or 5 year or whatever, how however long they can stop themselves from worrying. That probably depends on their genetics. But anyway, um,
D'accord, oui.
so I definitely think that so for that demographic specifically, especially some of the newer tests that are out there, the liquid biopsy, the tear breast one, um,
Mhm.
those are really great because they're direct to consumer. Your doctor
Mhm.
can call you a hypochondriac all they want, and you can still get the test anyway, you know, and what they cover is such a wider, especially the liquid one, such a wide range of things. And you don't have to drink any prep and have diarrhea like you do with the colonoscopy, which you should also start getting as soon as it's recommended by your physician, by the way. But you know, our tests are pretty easy in
Yes.
terms of like how hard they are on your body and how much people
Yeah.
dread doing them.
Yeah.
Very low dread factor here.
Yeah.
So that's where I would go with it because then you've got some answers. And obviously people when you can get your colonoscopies, get your mammograms and all of those things
Mhm.
because then you know.
Yeah.
Um I don't
Yeah.
know what are your thoughts?
Yeah, I always try to dance the line of being pragmatic. I don't like ordering every test under the sun. This said, especially as a computer science training, I love me some data. So allow me to break down some of the test options that you just spoke to because I think they're very powerful. I have conversations sometimes with colleagues, and the interesting thing about that is I remember when I started into this profession, maybe 10 years ago, I think. I don't do time very well. I think it was about 10 years ago, probably a bit before. Um, when I started into this, I had this thought that like within my lifetime, cancer probably wouldn't be cured. And here I am 10 years later, and I'm like, I don't think we're necessarily going to be curing it, but I think we're going to be catching it so early that it will be managed and seen as a chronic disease as opposed to this scary thing. And liquid biopsy is, in my opinion, kind of the pathway towards that. So what is a liquid biopsy? Okay, so you give up to a nurse a sample of blood, right? You go to a testing facility, they take a little vial of blood. We take that vial of blood, we toss it into a fancy little machine, and that fancy little machine is going to read that blood for all of effectively the DNA within it. And then I'm talking rough terms here, but roughly what then happens is all of that information, right? We need computers. We need computers in order to cure cancer or to identify cancer. We take all that DNA and we compare it to various libraries of known DNA mutations and what cancers those are associated to. So really what we're saying is all the little DNA strands that are in your blood, are any of these known to be associated with cancer? If so, how much is there? And where might this cancer be coming from? Right. And I think this is a really powerful thing because I don't know. The approximate numbers is that within the US, 70% of cancers that are diagnosed, there's really no screening for, right? From a screening perspective, colon cancer, breast cancer, prostate cancer, to an extent cervical, right? Depending on where you are, please get your PAPs. Um, all of these things they have screening protocols. Most other cancers don't, right? There's some skin there, but other ones don't. And so this is checking in on the blood. Are there mutations that are suggestive of, right? So that's one. The other one that you mentioned, and this is a something I love, it's a tear test, right? It's a tear test that this is for females, right? I want to acknowledge males and men can get breast cancer. Um, this test, unfortunately, we don't have sufficient data to extend it out to male participants. So it does need to be a female or a woman participant. Okay. But really what it's doing is you take a little sample of tears and it's looking for protein that's associated with inflammatory changes that are related to breast cancer. So this is not a diagnostic test, please hear me. What it says though is your body is showing proteins that are associated to changes that we see within cancer, and you should probably go get some more advanced screening. And the reason I love this is A, younger women are told until you are 45, 50, you don't have access to mammograms. And this changes that, right? This changes that a little bit. Yeah. So I think those are the tests that I'd want to go over. Another one of my favorite tests, and I wonder if you can talk to this a little bit, is um, looking at a person's genetics. So we know there's cancer specific for inherited. We're not talking about that, right? Those are panels that you'd really run with your doctor through the hospital, through an oncologist, through your GP, depending on the gene. But what about from the prevention side? Like, what are you looking at to say, how do we even get to the point where we're screening for cancer?
Right. Right. Um, so when I think about the ways that I mentioned that our bodies naturally fight it, one of the first things I think about is the immune system.
Mhm.
And we want to keep the immune system as healthy as possible. And there are some genes
Mhm.
that mean that people might not have as much circulating vitamin C. They might not
Mm.
have as much circulating zinc in their
Mm.
bodies, and they might not be supplementing because they don't know. And
Mm.
so I would want to know what their those genetics are like so that we can so that we can optimize their immune system. You can and then also, just running uh, uh, blood tests to see
Yeah.
what are their white counts like, all of those
Yeah.
types of things that you can also screen. But knowing if someone needs to be eating more of something in their diet or supplementing with something in order to have their immune system functioning optimally, I feel like is also a really big help.
Yeah. Yeah. No, I like that as the first thought because we already said, right? Every person every day is getting a little bit of cancer. And then it's the immune system's job to go to be like, not today, Satan, pop it down, right? Clearly walk a little bit of drag race. um, but to quash that down, right? And so I like this first thought as to the immune system because we know that's so inextricably linked. What are some other, because I think of like when I counsel people on prevention, right? The advice that I always give people, they kind of stare at me and they're like, you do fancy science. Why the hell are you telling me this? Because my advice to them is always sleep, eat your vegetables, try not to stress too much, and you got to move your body, right? It's the very basic foundational advice. And most people get very frustrated with me because they're like, if I wanted to do that, I would, go like I wouldn't be here, right? But I think where genes and what you're getting at with the immune system is our genes really refine how to focus on those spaces, but separately which are weak, and therefore we need to focus most on, right?
Yep.
Do you want to meditate on that a little bit? Because if someone comes in and they're like, I have all these things that I should do, what should I prioritize?
Well, yeah, we can. So how much exercise should they be doing? What type of exercise should they be doing? And what should they be eating? And our
Yeah.
genes can really give us kind of a roadmap for some of that. I mean, of course, everyone should eat vegetables, and they just need to. It's
Yeah.
just, you know, that's just a
Sorry.
fact. Um, but in terms of how much of other things, some people don't utilize fats for energy very well. Some people,
Yeah.
if they eat starches, their blood sugar goes haywire. And guess what? That's going to create inflammation. And inflammation is not great for the system and can contribute
Mhm.
to the development of cancer. And
Yeah.
so it's and if somebody is exercising too much, then they could end up with too many oxidants in their system. And if they don't have the right genetics for managing that, then that's not great for them. That can cause inflammation. So basically, it's like what would cause inflammation? How can I prevent it? Not that all inflammation is bad and not that we don't need it for things like,
Yeah.
when we exercise that causes inflammation, but then it goes away.
Yeah.
It's not that it's a good inflammation, but it has a good effect, right?
Mhm.
Um, and I mean, my brain goes to patterns of things. Like, is
Yeah.
there, what is there too much of? What is there too little of? What is there so much of that it's making it so that there's too little of this thing? So
Yeah.
it's all about balancing all of those
Yeah.
things out. And so,
Yeah.
looking for what those imbalances are is just what my brain does. And
Yeah.
when I talk to someone and look at them and take their pulse and all of those things, I'm
Hmm.
figuring out some of those things from other measurements without their DNA, but now I also have their DNA.
Yeah.
So that really is, that just is like the absolute
Yeah.
icing on the cake in terms of being able to pull apart what makes an individual respond to their environment and their lifestyle in the way that they are. Because just because your cousin does something
Mm.
doesn't mean that it's for you. Your cousin might do
Mm.
CrossFit. CrossFit might not be good for you. Your cousin might be able to eat a plate of French fries. You can't eat a plate of French fries. You know what I mean?
Yeah.
It's just
Yeah.
it's all about what's right for the person.
I think that that kind of gets back to something you said at the beginning of this, right? When we hear someone has cancer, we think to, oh, well, they smoked or they did this or they did that, therefore they have it. Whereas I don't do that and I'm fine. Right. And it's this idea, you always hear about that, 100-year-old woman who smokes and drinks every day and is totally fine compared to the 30-year-old who lives this beautiful life and then all of a sudden has breast cancer. It's not a question of deserving, it's a question of environment interacting with genes.
Yep.
Right. And so when you know the gene side of it, you know what you're more susceptible to and therefore more at risk for. And for those that don't listen to me often enough, and that's maybe a good thing, I believe in lazy medicine. Do as little as you can for the biggest bang of your buck. It's part of why I'm in genetics, right? Because I know, right, I have horrible detox, so I need to invest a lot of energy and effort in that. Whereas my hormones are pretty okay, and so I let those coast on by on their lonesomes, right? It's in my mind, at least, being as lazy as possible, right?
Well, and then like I don't know, this might be totally off topic. I'm not off topic entirely, but when I was looking at a study
Hmm.
about cancer treatment and it specifically for HER2, HER2 positive
Yeah.
breast cancer,
Ooh.
and the response to chemotherapy, whether or
Mm.
not the brain fog went away,
Mm.
and COMT's role in that. And so
Mm.
people responded differently. And so I was thinking, okay, is it the COMT gene or is it what the COMT gene does? Not that this is my job to figure out, but so
No.
somebody might hear green tea is an antioxidant. It's really good for preventing cancer because of that. They
Yeah.
might be drinking 14 cups of green tea a day. They might have a slow COMT, and that might be making it worse. And I'm not saying it's their
Yeah.
fault, but what they think is such a good thing might actually be having a detrimental effect on their system and its ability to go back to not having brain fog afterward. And when I
Yeah.
looked at that, I was just like, it, the gene stuff is so important for not only for
Yes.
prevention but for during the treatment, after the treatment, just knowing what your body does, what it likes, what it doesn't,
Yeah.
how it's going to detoxify if you're doing chemotherapy, how to help it rebuild afterward, what these treatments do to the gut microbiome because of that high cell turnover in the intestines, like you were talking about. That if it's
Yeah.
that the anyway, so I I don't know where that came from, but
No,
there it is.
I love that. So to ground that for a little bit of our audience, what Dr. Study has just referred to is green tea is very, I think it was first studied in breast cancer and it's expanded into a few other cancers. Green tea was studied in that if you consume so many cups or so many pills per day, it can reduce risk. Right? But that risk is, it's not like 100% efficacy there. There's always that nuance. And what she's presenting is if you have a specific COMT presentation, right? Namely, you're slow methylator, you're slow with your COMT, large volume of green tea, right? Is not proven to be helpful or beneficial. It's actually, to an extent, proven to be detrimental, right? And so it's this genetic nuance that, to an extent, explains what we've seen in research. It's this very powerful thing, except in certain people, and you don't really know that until you know who you are against. Yeah. Yeah. And I think I want to start transitioning into questions because I'm seeing a beautiful amount in our Q&A. But before that, just based on numbers of people who are here in particular, there's quite a few that said they've had cancer, right? And I think something that you've touched on really elegantly, and something I would really encourage people to reach out for care and support with a very informed practitioner, is the idea of aftercare and how do you build up the body after, heaven forbid, you have cancer. So one thing that the oncologists don't necessarily talk to you about often is when they study cancer and they get to the point where you get to say, um, I am currently disease free. The phrasing used to be in remission. We're now trying to use the phrase inactive disease because we're trying to look at cancer as a chronic illness, right? But so if you've had cancer and you've passed that, usually it's 5 years, depends on the cancer, but you know, that window where they say, okay, you're doing great, you're considered in an active state. Okay. What they don't talk about often is the fact that that's when you start seeing risk of heart attack or stroke increasing, risk of other cancers increasing, right? Because they're just studying one cancer and did you make it past your window? And so if you've had cancer, I don't know the exact number, but you're more likely to have it again. It's just kind of a crappy reality, right? But what's really, really important in my mind once you've had cancer is how do you rebuild the body back up? Because you want to mitigate that risk as well as things like cardiovascular disease as much as possible. And this is not, oncologists don't talk to you about this. And I don't think they're trying to hide anything. It's just they're focused on the cancer before them versus the person once they've made it to 5 years. And so I'd really encourage if you're listening to us tonight, you've already had it, thinking through either what can you take from this webinar, maybe what can you do if you were to engage with a doctor's study of the world in order to build your body back up after that, right? I guess you work with, I'm not trying to plug you, I'm just curious. You work with a lot of people in that aftercare space.
I've worked with people during and in the
Yeah.
aftercare like getting them to getting someone so that they can actually be strong enough to
Yeah.
continue with their treatment. You know, that to me was always
Yeah.
a really important piece that
Mm.
that I could provide. You know, that was like,
Hmm.
okay, I can do this for this person. I can help kind of um, put a little bit of bubble wrap
Yeah.
around them so that they can delicately get to where they need to go, and then afterward, um, helping them physically and emotionally to deal
Yeah.
with the aftermath. Yeah.
Oof. Yeah, I think that's where our mood and behavior genes come in, right? The rate of PTSD and anxiety and other survivor's guilt and those sorts of things skyrocket as well. They might be there in body, but they're not necessarily there in heart and mind.
And I think also um, being surrounded by people who haven't been through it
Mm,
and feeling sort of alone in it, I think
mm,
is really hard.
mm,
Because even
mm.
if people show up and they bring food and they give you rides to get your treatment and all of those things, people have described to me feeling alone in it because nobody that they're close to has been through it and does they don't really feel like they're putting on a good face, or people get weird when they talk to them, like
Mhm,
they don't know how, like they're like, I'm still me, you can still talk to me like you always did. But so that whole experience can be really emotionally challenging for people. And so getting support during and after that and acknowledging that it was hard, I think is really important.
yeah. If we look at it alphabetically, people are scared of the big C word and then even more scared of the big D word. Yeah, yeah, yeah. Okay. On that most delightful note, and I'm glad you I no, but I'm glad you brought up the word death and the concept of death because I think part of our worry and struggle with cancer is the fact that it's so intricately, tightly brought to that. And if we were able to kind of tease that out and focus just on the cancer, right? I think D word for Barbara who's asking. I imagine some people could have taken that in so many different ways, and there's clearly not sensors on tonight. I'm not talking about male appendages. I'm talking about death. That is the D word. All right. On that delightful note, I'm going to jump into the questions and answers so that people who are here can hear us roar. Um, okay. So Mio, I hope I'm saying that right. Mio, unfortunately, their father was recently diagnosed with multiple myeloma. What DNA combinations from the DNA 360 report should I watch out for? Yeah. Dr. Steady, did you want to start off with that or shall I? It's up to you.
I have to confess that I was reading a question in the chat and I
Mm,
did not hear the question, and I apologize.
yep.
It caught my eye and
Yep. No, that's
I
okay.
got
That's
distracted.
okay. I value so much your honesty because I would have tried to like been like, I value
Yeah,
your honesty.
there was nothing
Yeah.
there was no way I could fake my way through that. No way.
Yeah, so Mio, what I would say is please, first of all, please do be in touch because I think the answer to this question really is going to depend on where your father is in regards to treatment, right? As Dr. Seti has beautifully articulated, are you going into treatment? Are you in the middle of it? Are you in the after portion of it? That really changes what we want to be looking at. But just knowing this, the things that I would be really focused on first and foremost would be methylation. Okay, so methylation is one of the systems within the body that helps with DNA. It helps with tissue repair. It helps with many, many different things, right? You want to know that that is well supported so that can go through. So there's within the inflammation report, there's a section on methylation. I'd look at that, ensuring that supplementation and support of that, either through supplements or food, is on point. The next thing I'd really look, especially if you're kind of going into or in the middle of treatment, is how do we optimize metabolism? Okay, so really focusing in on diet and nutrition, namely, how do you respond to carbohydrate? Right? There's a lot of discussion around how cancer and sugars are kind of besties in not the greatest way. And so we want to know how is your father managing those carbs and how can we take insight there to better support optimized diet to the end of, sugar regulation, but very separately, how do we keep meat on those bones as you go through something that tries to take the meat from your proverbial bones? Last but not least, and I think this is especially important as you're going through active treatment, right? We talked about treatment's kind of a bomb that goes off in the body. It impacts cancer, but it also impacts the whole body. You really want to know your detox pathways. You want to know how can you support, right? The cleanup of. Okay. And I'd really encourage, especially if it's active treatment, find a care provider that's very familiar with that space. You can reach out to us if you like, because for a lot of chemos, some of the supports we would say to support detox will be say, hey, you can't do that. It interacts. So having a practitioner that knows that very specific nuance is exceptionally important. I, I always push people towards seeking and working with a practitioner at this because you don't want to be doing this on your own because there's too much to read, there's too many interactions. Dr. Steadies, did I miss anything? Anything that you can think of?
I don't think so. You don't usually miss anything. So,
There are times, but I value that compliment. Thank you. I'm gonna own that one. I'm gonna pretend
own it.
I don't ever miss time. I'm always on time.
I didn't say ever. I said usually.
Touche. All right. So Mio, I wish the best for you and your father. I think in particular, I would also pause and offer that your father going through cancer also means you're going to be going through it. Caregiver burden is a really real thing. Um, it can be very isolating and there's a lot that goes with it. I think there's a lot of people in our audience tonight that are coming in as caregivers. And I'd really encourage that as you support your father and get medical support for your father, do it for yourself. Because you supporting someone going through cancer will actually change your health outcomes. I'm not being hyperbolic or I'm not exaggerating anything here or making things up, right? Dr. Steady's nodding. The risk of cardiovascular disease, et cetera, will go up in caregivers because they tend to put the wellness of someone else before their own. And so just for you as well, something to focus on.
Which is why if
Okay.
you also knew how your body responded to stress genetically, that would also
Yeah.
be so if you had your 360 report, I would say you focus on that as well.
Mm-hmm.
because understanding, I feel like that really it helps to understand.
Yeah.
Um, Self-knowledge is just so empowering, I think.
Mm-hmm. Oh, okay. You just inspired a thought, and I think this is really important because I also think it's really cool. I love when technology can come in and act as medicine. So I learned this really cool thing. So whether you have cancer or whether you're supporting someone, look in your mood and behavior report. Okay. And I want you to look at genes that really predispose you towards, welcome, cat, predispose towards kind of more of an anxious or traumatized tendency. We're not talking PTSD. We're really talking about something you experience in the past, something very emotionally salient, which cancer is, right? How can we prevent that memory from being so deeply ingrained that it's something that you, even once you're past that event, feel like you're still living through? Here's a really good thing, and I'd encourage this if you're going through cancer, supporting someone. When you go through that really stressful day, maybe it's a day of chemo, maybe it's a day of diagnosis, whatever that is, and you have those predispositions of stress, or you don't, do something mindless afterwards. There's a really neat study that looked at people who experienced a traumatic event. This was through the military, so a traumatic event, and then they gave them Tetris video games. I'm not familiar with video games, but it was something clever like Tetris, right? Not too involved. We're not talking shoot 'em up games. We're talking about Tetris where you're trying to fit blocks together. And if they played those for an hour or two after that traumatic event, it actually lessened the encoding of that event in the brain. Okay. Yes, ma'am. Isn't that cool? I know,
That's so
right?
cool.
I know.
I
This
want you
is
to
where
send me
someone
that
has to come
study.
in and tell me to calm down. So if again you're going through this or any life event, right? The world's maybe slightly chaotic right now. Maybe. But if you're going through anything, right? Play Tetris for an hour or two, and that will help lessen the encoding. Okay. So, and now you know there's the stars. All right. Dr. Steady, I have another question for you. Oh, mon Dieu, this is gonna have us get into this. All right. People wanted controversy. Here we go.
Oh
Can
boy.
vaccination cause cancer?
I don't know.
Hmm.
Um,
That is a true scientist's answer. Yep.
yeah.
Yep. Okay. All right. So let's dig into this. And I'm going to take out some of the more recent vaccinations, not because, and I'm going to be very specific and pointed, not because they do or do not, but because I don't think we have data enough to say yes or no any which way. So I'm going to take those out, not because they do or do not, but because with mRNA vaccinations, we don't have enough data to say yes or no. Going to talk about historical vaccines. So these are kind of all the childhood ones that we know of, as well as the emergence of here's a vaccine for shingles and here's a vaccine for HPV and all those fun things. Okay. Vaccines, by and large, you're going to get something that triggers the immune system, right? So it aggravates the immune system, and then separate, you're also going to get a little bit of an immune product. So what happens is the body kind of thinks it's getting sick, and then the immune system's like, cool, I'm going to learn about this so it can't happen again. Okay. It's how we've eradicated polio, it's mumps, and a few other things that are now starting to creep back up. Okay. There is no, to my awareness, large scale study that says if you get this, you're going to get this sort of cancer. It increases risks of cancer, et cetera, et cetera. To a certain extent, there might even be evidence that it can decrease because, we talked about viruses, et cetera, right? Viruses, et cetera, and how they can spur on cancer. Now, the flip of this, and this is why I said Dr. Steady was being honest as a scientist when we say we don't know. Research is now able to penetrate a lot deeper into kind of genes and how people respond to certain things and how certain adjuvants, the things that ruffle up the immune system so that you get a reaction when you have this vaccine, we're able to penetrate deeper both into the genes as well as individualized studies that say if this person, then maybe it does. So I would offer there's two things that are true. Categorically, we're not really seeing that relationship. That said, as we develop more individualized study and personalized medicine, for certain people, the answer may be Yes, right? Just based on the mechanisms that are there. Okay. So I know most people aren't going to like that answer because we've effectively said we don't know, but that tends to be the truth as we know it right now. Did I say anything off there? Did I kind of represent your
Yeah, I guess one of the tricky things for me is
mhm,
that because everything to me is very individual,
mhm. Yeah.
you know, I can't say to you, no, it won't, or yes, it will, whoever asked the question, I because I don't know that. And
Yeah.
as we were saying with some other things like the green tea thing, all these studies said this, except for these people. There are always
Yeah.
exceptions to
Yeah.
everything. And in some people, things might prevent certain things, and in another person, it might cause them.
Yeah.
And
Yeah.
that's the nature of people being individual. And that's one of the reasons that there are always some people in any study that whatever said
Yeah.
intervention doesn't work for. I mean, there were people who were more or less affected by my acupuncture treatments
Mhm.
because they're different. It wasn't that I did some
Yeah.
like liked one of them better. You know what I
Yeah.
mean? It's that people have different responses to things.
Yeah. Yeah. And that's why I think when it comes to vaccination, kind of the better doctors will allow for the conversation of let's talk about it in context of you, right? They're not going to force you to a yes or a no. They're going to have that conversation of let's talk about it in the context of you. And I think that's a really good point because it's you ask me, is vaccination good for you or bad for you? I say depends on you. Overall, for society, it's been a good thing, but right. And again, I'm talking historical vaccines. But there's always that individualized question that's really, really important to have. And I think we as clinicians need to have that more often with people because I think shoving the answer of yes or no down to people's throat is clearly not working for us. Yeah. Yeah. All right. So Lydia, I hope that was a good answer for you. Um, the next question is coming from Tisha. Tisha, not Trisha. I need new glasses. Have there been links between COVID and cancer? Dr. Steady, are you up on the literature there?
I don't know that either.
Yeah.
I feel a little,
Yeah.
but
No,
if I
it's
don't know something, I'm not going to pretend that I do. So
no,
that's
I
just
value that. I value that. I
I read a
yeah.
lot of things, to an annoying level, um, but I can't read all of them
Yeah.
because it's
No, no,
just
no.
humanly impossible. So
Yeah. Yeah. So I will offer a few different things here. Uh the evidence is going to be emerging, right? We're 5 years out of COVID. And so for any scientist, except for maybe on a case study level, case study meaning a doctor or a scientist followed one person, there's not going to be the evidence that says yes or no. This said, we know a few different things. Number one, we know viruses, COVID is a virus, can spur on cancer, right? So is there a chance that it is spurring on cancer? Probably, right? We know that Epstein-Barr, we know that HHV7, there's a six, sorry, there's a few other viruses that we very inextricably link to they will spur on cancer. So probably is the answer there. We also know that people who have had COVID, in particular those with long COVID, right? We also know that their immune system is absolutely bonkers and struggling and not well. And Dr. Steady has very beautifully and elegantly said, you need an immune system to bat down cancer. So will that increase the risk? Probably, right? Okay. We also know that I mean, part of the immune system is cytokines and a few other things. We know those are really involved with cancer. So again, there's, it's going to take a decade or so before we're able to come out with studies that give us an idea of yes or no. But my personal suspicion, based on what we already know of cancer, is the answer is going to be probably yes. Does that mean you're going to get cancer because of COVID? No, because the things we've talked about tonight, what you can be doing to prevent. C'est bon? Oui? Yeah.
yeah, and the inflammation from especially in cases of long COVID. I mean,
Yeah.
COVID is just such an inflammatory, I think more than some other viruses, it caused more inflammation than some. I'm sure that there are some that it
Mhm.
maybe cause more, but I think when I think
Yeah.
COVID, I just think huge inflammation and that affected multiple organ systems. And so
Yeah.
for me, that's another big piece of thinking
Yeah.
probably, but like you said, it doesn't mean there's a one-in-one correlation, right?
Yes.
So it doesn't mean if you had COVID, you will get cancer. That's not what we're saying at all. It's just that, could it be a tipping thing for some people that tips them over into the place where cancer can develop? It's possible,
Yeah.
but we don't know.
Yeah. I'm going to offer a bit of a passion plug. Um, we're and this will be in the summer. We, the DNA company, are putting out a program on long haul COVID, really because we see so many people coming in with long haul. We want to speak to what we know of the genome. How can we support the recovery therefrom? And within those conversations, again, we're not going to be able to say definitively we don't have research, but within those conversations, we have very definitive supports around inflammation and around the immune system, et cetera, all of which are going to kind of help mitigate and lower this. So if you're someone who thinks you're struggling with it, keep your eyes peeled for the summer, because we want to make sure, be it us or someone else, there's spaces that you can go to get very science informed advice. I think when we talk, COVID is so politically charged, vaccines are so politically charged, that I think when a scientist comes to you and says, I don't know, but here's the data, people stop listening because they'd rather hear a yes or a no. So I really encourage the audience to reach out to the scientists, to the doctors of the world, and hear the I don't know, and then hear what they know. Okay. Because that's kind of gonna be where the truth of it all sits. Eat, right? Okay. Let's see here. I'm gonna pull out another. Um, So Tisha is asking if we can repeat the genes and the proteins that we were talking about. Absolutely. What I'm going to do, Tisha, and this will probably take me a little bit, I'll put them in the chat for everyone, but I'm just going to get Dr. Study started on a question so I can start typing. Be there in just one second. Um, Pam is asking Dr. Steady, what methods would you recommend to support the body through chemo or radiation? Okay, so I'm going to already preface this. It depends on the person, depends on the cancer, depends on the chemo radiation. But Dr. Steady, do you want to give maybe a few general thoughts?
Yeah, absolutely. Um, so I mean, I may be biased here, but I think acupuncture can be it. You, your platelet counts have to be a certain place. You should always check with your your oncologist before you do it. But I think it can be really supportive. Um, as can um, Reiki. Um, as can support of any kind. Meditation, I think, is really great because being present with oneself during such a difficult thing instead of um it's hard to do. It's really hard. Because it brings up a lot of stuff, but I think that the ability to stay present in an okay way. So that, mindfulness based stress. Oh boy, we've reached the point in the
Words.
evening where my tongue doesn't work anymore.
We all get there,
Mindful
girl.
mindfulness-based stress reduction is what I was trying to spit out. Um, or really any kind of meditation can be really great. Neurofeedback, can be
Mm,
a great thing. So, um, but really a hobby, connecting with loved ones and not isolating,
mm,
um, a support group for people going through the same thing. I know that you were probably asking about physical support, but for me, everything is this continuum. So we can't ignore the mental emotional components of things. So whatever you like that feels supportive to you and that makes you feel joy.
mm.
Um, because I think that that's a really hard thing to feel when you're going through something difficult, but there are sources of it all over the place. And so I think being outside is tremendously healing. Even if you don't feel up to taking a walk, just sitting outside and noticing what's around you, even if it's your neighbor across the street because you're in a city, like, th they can be a source of joy. So,
Yeah.
there's my crunchy granola answer for you.
I I'm I I'm gonna say your crunch, there's a lot of science that backs up your crunch.
Yes.
When I spoke to the idea of when you're going through cancer, having adjunctive care support through diet, etc., the modalities that you've just listed in regards to how do you calm your nervous system so that you can support healing are very important. Hear this. Your body has roughly two states, fight or flight, and then rest and digest. Fear, anxiety, all the stressful things, right? The big C word, the big D word, those kind of put you in that fight or flight. You're not resting, digesting, and healing in that fight, in that state. So all these tools that Dr. Study has just talked about, family connection, meditation, Shinrin Yuku, which is like dancing in the forest and having a great time, right? Getting out in nature. These sorts of things will help shift your system back. And they are a muscle. The more you practice them, the easier it is to do that shift. Is it always going to be easy? Absolutely not. There's going to be days where you're just going to be a hot mess, and that's okay. That's why you have community. But there's going to be some days when you're just a small mess, and that meditation technique that you practiced will truly shift you into that physiologic, neurologic state of healing. It sounds crunchy and it sounds woo woo, but there's a lot of data to back up the efficacy here. Is it going to cure your cancer in concert with other things by itself? No, but as part of a plan, it's really, really important. Yeah. Okay. Thank you, though. I love that. I love that you brought the crunch in because I think the crunch is really important here.
Well, what I will say is that having been a meditator for a really long time, I did a colonoscopy with no anesthesia, and they could not tell the difference in my vitals. My blood pressure and my pulse rate and everything stayed the same the entire time, and the nurses thought I was such they were like, "How are you not?" And I was like, "Because I meditate and because I know how to do that. If it's getting a little tough, I just do my thing." And so I know that that's a kind of an N of one. That's just me telling you a story about myself, but I really believe in the power of it to regulate these systems in the body that I had proof that I wasn't even looking for during that test. So,
That is mind-boggling. So without anesthetics, you were able to self-regulate. How long have you been meditating for?
in a serious way since 2011.
Okay. So that's like what, 13 years, 14 years in
Yeah.
that space?
Yep.
So again, hear this as a muscle, right? I first of all, I bow, I mic drop, I all the things. But no, but separate to that, hear that muscle. Like, I mean, I encourage people to hear that muscle, right? You have to eventually start working out that muscle. It might as well be today, as part of that prevention. Yeah. Oh, and Cindy's saying she actually had a similar experience. Cindy's saying that she has cancer. She has a port, or I would imagine cancer bringing about a port. And so when they're supporting that port, when they're taking in and out a few other things, she's saying she meditates and she maybe doesn't have the vital information because we're not tracking vitals in the same way as you would through a different procedure. But she's saying that that also helps. And so thank you, Cindy, for sharing that. Yeah.
Mhm.
All right. Um, Rochelle is asking what cancers are checked for in the dentist's office. I have a few thoughts. I'm not a dentist, but I have a few thoughts. I don't know, Dr. Study, if you know this a bit better than I do, but I've
Well, I mean, certainly mouth, right?
Mhm. Yeah.
Uh,
Yeah. I think it's a lot of oral inspection, right? Because you'd be looking for effectively precancerous or cancerous lesions. So I think it's more of a visual survey, right? As well as and I would imagine dentists can discern, right? Is there excessive bleeding untowards things that you wouldn't expect outside of just a diseased mouth, as well as reports of, like, oh, this hurts, even though we can't see something. I would imagine that could also necessitate a trip to the doctor to find out if there's something space occupying behind the mouth. Yeah. Yeah, I hope that answered your question, Rochelle. I'm not as familiar with that. Dr. Steady, Nina's got a question for you. Um, I read that Chinese medicine suggests the herb um, lei indica. I'm not sure if I'm saying that right. For leukemia and lymphoma. Unfortunately, Nina's older cousin has stage 4 non-Hodgkin's. It's difficult. Would you suggest this herb for that person?
So the complicated thing about Chinese herbs, from my perspective, is that it, we we prescribe them via pattern diagnosis. So
Mm.
so we wouldn't see um, two people having leukemia could have two very different presentations. And so it would depend on the presentation. And that speaks to what I was saying before about studies where it works for 80% of people and not for 20% of people. And one of the reasons that I always stick to my pattern diagnosis is because of that very fact. So I would never recommend an herb for someone that I hadn't evaluated myself to make sure that it was right for them. And I'm
Mhm.
not just trying to get out of answering a question.
Mhm.
That's why we do it that way. That's why it's always been done that way in Chinese medicine, is because we believe that every person is an individual. So I'm sorry that it's not uh, I'm sorry it's not just a yes. Yes, that would be great. But find an herbalist
Yeah.
in your area, somebody who can do that kind of diagnosis, and they will be able to help you out with that.
Yeah. Yeah. And I'll put your services out there as if you're hoping to work with Dr. Steady, you can get in touch with us. And I know you may refer out, if you need some physical assessment, but I'm also just going to put you out there because you're so lovely in the way you support and assess people. Yeah. I'll toot your horn for you. The next question I have here is from Laura, I believe. So this harpens back a little bit to the conversation we had on green tea, in that we think it should be good for everyone, and there's a small percentage where it's not. She's asking, what is it in green tea that's the issue and why? Do you want to take a jump at this, or shall I?
So one of the things that so the COMT gene breaks down the I'm gonna do my best to say this in
We're gonna do this together. It's okay.
yeah uh is it breaks down certain kinds of compounds, and green tea has them. So I'm gonna not pronounce it right. Catechins.
Ketchup,
I can I can
ketchins?
read it. I can't just say it because I never say it out loud.
She's talking. So when you talk about green tea, there's a lot of polyphenols or
BCG.
plant chemicals within it, and she's referring to a very specific one. We think it's called catchins. I'll type it into the box so that you
Okay.
can see. Yeah.
So but it's also trying to do a whole bunch of other things. So it's trying to break down so that they can be excreted, a bunch of other things as well. So if it's slow to do that, then if you're giving it something that it additionally has to break down, it's sort of like if you were in a boat that was filling up with water and you're trying to bail it out and somebody stuck a hose in it, right? You're not going to be able to bail it out as quickly. Boy, my analogies are just very special today. You're not going to be able to bail it out as effectively if your buddy is like, oh, you need more water in that boat. Do you know what I mean? So um, that's the best that I can do in at 7:23 in the evening.
No, I think that's great. Effectively, we're just saying that some people get too aggressive with this sort of thing, and so it's not for everyone. Yeah, and it's not to say you can't have any green tea. It's really speaking to the higher dosing. Let's be very plain and specific about it. It doesn't mean if you have poor comp, you shouldn't touch it at all. And when you're talking cancer, right, everything's magnified. You're talking big doses. We're talking like 14 cups, I think it is. And so really we're saying if you are applicable in this sense, you probably want to have just a few cups a day as opposed to 14 cups a day. How you would tolerate the caffeine, je ne sais pas, mais here we are. All
Because you
right.
also need to sleep, because sleep is also important, as it turns out.
Mhm. Yeah. Um, can you please touch on genes to look for regarding breast cancer? And this is coming from Rosie or Rossi. I'm not really sure how to say your name. So, Rosie, we did speak about two at the top, and those are more diagnostic level, right? In the sense that a physician will run those and there's a disease defining specific to breast cancer. You've asked the perfect question insofar as Dr. Steady is a beautiful expert when it comes to hormones. And so when you talk about the DNA 360, you'll get a sex steroid hormone profile, right? And that will really speak to how do you metabolize different, and in this case, what's to an extent important is going to be estrogens. Dr. Steady, do you want to kind of speak to why that's important, why it'd be helpful to understand this?
Absolutely. Because when when estrogen is being broken down, um, it can go into one of three well, it goes into all of the pathways, but our genetics determine how much we tend to go into various pathways. The the 208, I'm just going to say what they are, but then I'll explain some things about them because I can't not say what they are. I'm trying to avoid it, but it's too much.
Please, no,
2OH,
please.
4OH, and 16OH
We have a
pathway.
really intelligent audience. You're good.
Um, so so if one tends to not favor the 2OH pathway, but instead favor, let's say, 4OH, it would be really important to know that because we can actually do something about it so that it goes down a pathway that it's easier to clear things out of. Because when things turn into, let's say, 4-hydroxyestrogen, then they are a bigger problem for the body. They're more inflammatory, they can cause DNA damage. It's not really what we want to do, and we only want a certain amount of the 16 as well. So knowing what your body's tendency is and then what to do to help it to make different choices if it's making it in a way that, and there's testing around this as well, so that you can prevent a problem before it starts. That's one of the really um, shining things about knowing one's genetics is that you can know what your tendency is, and then you can also see if it's playing out or not, and change something about it. So this is not something that you can't do something about, and that's where empowerment comes in, is that there are supplements, there are lifestyle things, there are all of these things that can be done to change it so that you're really going down the easier pathway to clear. Does that make sense?
Yeah, I love that. I love that. And I think that's the beautiful balance between kind of those inherited versus what can we do? We're not necessarily talking about acquired per se, but what can we do in order to lessen that acquisition? Yeah. Okay, Laura is asking a fun question of us, and Dr. Study, I will tackle this one. Um, Laura is asking if we can speak to IRS5. So RIS5 refers to a collection of 5 different proteins within the insulin regulation substrates. These, without getting too technical, these are going to be proteins that support metabolism and insulin and blood sugar management within the body. And so there's some research that is suggestive that suboptimal presentations, possibly even mutations of these genes, may lend to specific forms of cancer. It's something that's really being, I guess, actively explored with specific points of cancer. But then separate to that, and we've alluded to this, there's this idea that sugar metabolism, metabolism in general of the body, right? So think of that diabetic spectrum, right? That this sort of thing can encourage cancer, right? And the why of this is, remember that cancer is kind of that really excited person that's like, I'm going to do everything. To do that, you need a lot of energy. So cancer is going to consume a lot of energy, and there's a bit of a chicken egg and egg question, right? Does the too much sugar encourage compared to, or does it just have to always be taking it because it's bouncing around, right? So there's a chicken and egg question, but we do know categorically too much sugar, dysregulated sugar, et cetera, is going to kind of increase risks. So Laura's asking, can we dive deeper into this? And so I would say right now, research doesn't allow it. There's some suggestion that there's a lot of connection, both in that higher level of sugar regulation and then very specific to, I think it was lung cancer. I don't remember. I'll be honest, I don't remember the specifics, but I know that there's some research diving into it a little bit more pointedly. And so I would offer, independent of what research finds, we already know blood sugar management is very important. And so focusing on that general principle, as opposed to do I have that specific mutation, I think at this point in time is a good use of energy and effort, because we know managing your blood sugars is going to be helpful. We don't yet know what do these gene presentations beget you. Yeah, so that's my thought there, unless you have anything else sweet to say on the matter of sugar, Dr. Steady.
I do not.
Yeah.
Keep the rose bush healthy. To bring it back around to the beginning.
Crunch, 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 crunch. All right. Corey, and I hope, Corey, I'm saying your name right. Um, are there SNPs that affect a woman for both Parkinson's and breast cancer, brackets, or cancer in general? So, Corey, I hope this possibly means a dual diagnosis, but Dr. Steady, do you want to talk? When I think Parkinson's, right, I very much think environmental. Do you want to maybe speak on some of our detox there?
Um, our detox. So if I'm thinking detox, in addition to methylation, I'm also thinking about the GST family
Yeah.
and eh, how our body deals with glutathione, and there are several different phase two uh, detoxification pathways, and glutathionization is one of them. Sulfation is one of them.
Mhm.
The methylation is another one of them. And what's what am I forgetting? A glucuronidation.
Glucuronidation.
Yeah.
Yeah.
So the testing looks at some of those, and knowing how well you do those also tells you how much effort you should put into either fixing those or strengthening the ones that are already strong, but not too much. So just knowing how your body likes to do it, and giving it what it needs to do it as optimally as it can. So that I don't even remember the original question.
It was speaking to Parkinson's and breast cancer and kind of detox
Oh,
pathways and genes that you might want to, yeah.
yeah. So definitely detoxification.
Yeah.
One of them.
It's been a long day. Yeah.
It has been a long day.
It has been a long day. And I'd also really encourage you, if you're looking for support for those sorts of things, I think those are very big words, and knowing the health history and knowing what's going on in your world and other treatments and how things can be supported in there, I think is going to be really important. So I'd really encourage you to kind of talk to someone about, specifically how are your genes going to be at play there. Because I think Dr. Seti, there's no way she could give you a good answer so specific to your case, because there's so much to consider in one of those conditions, let alone the overlap of both. But I think glutathione, knowing those genes, knowing your copy number variations there, will be really important, because that guides how well are you detoxing stuff compared to how much support and what sort of support you need. Yeah. Um, Christina is asking oh, sorry, Pam here. Oh no, we've answered that one. Christina's asking our last question of the evening. Um, so she's asking if a hydrogen machine, and I would imagine this is something that supports water hydronation. We're not talking like a nasal or an inhalation thing. Um, Is that something you would think through as something to support with cancer?
Hmm. I guess I've always thought of that as like, um, I've never thought of it in that context, so I'd have to think it through.
Mm,
I've more thought of it in terms of like exercise recovery and things like that.
mhm.
That's the context that I've heard about it
Yeah,
in. So I would have to
yeah.
think about that. I'd have to
Hmm.
think about the mechanism. Yeah, I can't. Unfortunately, I can't think that quickly right now
No,
to be
no,
able to
no.
think it through logically.
Yeah. Here's my gloss on this. I think a lot of kind of the texeutical stuff, so like machines that hydrate water, texeuticals. come out of honestly often cancer spaces. And you've heard the why this evening, right? Because when you go through cancer, you're going to go through chemo, radiation, et cetera, that's going to beat the crap out of your body. And you have to figure out, how do you build back up this body? So there's a lot of fancy things. That's kind of where we started using light therapy initially. That's kind of where fasting started. Like, there's a lot of things that will come out of that, because you see this very depleted body. And so you see very much the exaggeration of how do you support some of that healing. Okay. I have not seen literature that is specific to, does hydrogen prevent, and separately, does it support navigation of cancer? Okay. Does that mean it does not? Absolutely not. It means we don't have literature. And right now, there's not compelling evidence that is really pushing some of that, right? I think, we had a conversation last night around COVID, and we talked about inhalation, how that can really be supportive in long haul, amongst other things. So I think with hydrogenated water, it's a huge, huge hyped up thing right now, right? There's a lot of people really excited about it. And I'm not saying it's not worth the hype. I think there's just still a little bit of science and case specific studies, okay, that are able to speak more to, or that need to be developed to speak towards this. So my answer when people ask me this question is, I will be very plain. There's not really documented evidence. That doesn't mean it does or does not work. There's no documented evidence. And I would ask, is it within your budget, right? If you kind of have an infinite budget, go right ahead. There's absolutely no harm that we're aware of you doing this, right? And so if you have an infinite amount of budget and you're hydrogenating your water, right? There's not really anything lost if it doesn't work, other than, the dollars out of your wallet. But if you're a little bit more conscious of money, perhaps think through different things, because there's other things that will have more marked evidence behind them. Okay. And I know that, again, sounds like a bit of a wishy-washy answer, but I try to ground answers in what we concretely know, with awareness that to push science forward, we have to ask the question of, does this work? And always, always, always that initial answer is going to be, no. So dance gently with that sort of thing. All right. Dr. Steady, how delightful this evening has been. Thank you. Thank you for joining us here. And I want to really, really thank the audience that is here this evening for coming. What this presentation really did inspire, if you're still here, please hang on for just another minute. If you're interested in some of the testing that we've mentioned this evening, so this is going to be our liquid biopsy, this is going to be our DNA breast 360, so that tear test. If you're interested in any of those, if you go to the website, there's already a 10% discount. We typically don't offer discounts on these tests, because we run really low margins on them, because it's important we get these tests out to people. So please, if you're interested in this sort of thing, please go to the website. There's a limited time discount for us. And if you're interested in interacting and engaging with any of us, getting more detail around your care and case, please don't hesitate to reach out to us. As you can tell from Dr. Steady and I, our hearts sit in the space of how do we serve best, and how do we support not only the body, but the humanity and the heart behind the body. So I believe that is all for us this evening. Medell, thank you so very much for joining me tonight. And we will, never mind. I think Christina had a question, but Christina, please do email us. I think Tracy's going to offer you her email there. Okay. All right. To everyone, thank you so very much. And again, please keep your eyes open for when we offer more webinars on cancer aftercare, and just very specific to cancer. Dr. Steady and I get very passionate about this. And so we want to make sure from the prevention side, the current state side, and then the aftercare, that you're being offered the best information out there. Because Mondia, when you get cancer, you know that everyone's going to sell you their snake oil. And so we want to make sure that we're discerning through all the snake oils. Yeah. Okay. All right. Au revoir, mes amis. We'll see you next time. Au revoir.